Good evening, everyone. You're very, very welcome to the Masters in Public Health and Health Promotion by the University of Warwick. We're so delighted to have such a wonderful group on here this evening. I know it's late in the evening for many of you and you've had a very busy day and you're probably exhausted. So we'll try and stay within the hour, but thank you for joining us. Just to let you know the running order for today, we're going to have a fireside chat first with our Director of Academic Affairs, Mr. Diarmuid Brannock, who will be discussing the public health programme with two of our senior academics, Dr. John Fletcher and Dr. Kunal Patel. And we're delighted to have them here with us this evening. So we'll be just talking in general about the programme and the nuances and how it differs from other public health masters that you may be looking at the moment. And then we will go into the overall programmatic review, and that will be about your curriculum, your time commitment, your fees, the entry requirements, etc. So we should cover all that. And then at the real end, we will open for around 15 minutes to an open Q&A session. And you're happy, we will be reading out questions then from the chat, but we will answer questions throughout the webinar as well. So without any further delay, I'd like to hand you over to our Director of Academic Affairs, Mr. Diarmuid Brannock.
Thanks a million, Rebecca. I'm delighted to meet everyone this evening. So as Rebecca said, I'm the Director of Academic Affairs, so I look after all of the faculty delivering this programme and the quality assurance end of it with the University of Warwick. Delighted to be joined this evening by our programme leader, Dr. John Fletcher, and by our Deputy Programme Leader, Dr. Kunal Patel. Actually, and just can I ask Rebecca if there's a bunch of people I see that don't have their audio connected. Could one of the team just put up the instructions as to how to connect to audio just in case they're having difficulty?
Of course.
To start about the programme, John, you are dual qualified in family medicine and in public health. I suppose two very fundamental questions. One, what do you see as what public health is, and why did you choose a career in it?
Yeah, I mean, public health is about populations. So this course is all about caring for populations rather than just people one at a time. It's large groups. And one of the definitions of public health is that it is both the science and the art of promoting health through the organized efforts of society. So there's a lot in that definition. We'll be covering basic sciences on the MPH program, but also giving skills in the art, which is getting people to do things. And often in public health, the skill is not so much doing things yourself as organizing other people to do healthy things and to deliver healthy programs. So that's the difference between, I guess, clinical medicine and public health. Well, I trained as a doctor a little while back, and like every doctor, I guess, the most exciting patients are the illest ones. So I did my preliminary junior doctor training at Cambridge, and then infectious diseases at Oxford. And I went to work in Africa for 3 months, partly for the experience and partly because I'm interested in charity work. It was one of the most exciting jobs I ever did because a lot of people were ill. So I treated tuberculosis and malaria and typhoid. But I noticed that in terms of actually the number of lives saved, it was the nurses delivering the immunization programs, and it was the nutritional education of the health visitors, helping people feed babies and children better, and also the farming program that was attached to the hospital that I was at, getting farmers to produce better crops. I realized that actually this made a bigger difference to people's lives. And so I came back from that job and signed up for a public health training.
Brilliant, brilliant. And it's one of the things about public health that has always struck me is that it generally has far more of an international perspective. And Kunal, if I come to you, I mean, you've done a lot of work in this area. What, tell us about some of the international development work that you've been involved in, why it's important to public health and why public health is important to it.
Thanks, Jim. Hi, everyone, first of all. So, like John, I'm a practicing clinician and originally trained back in the day, would you believe, in surgery. But what's fascinating about public health is that it brings a lot of disciplines together. And that's partly what my career has been, involved from surgery all the way to being an academic, which I still am, lab-based work, and it all built towards what I'm doing today, because every single aspect of my life has contributed to what I do now, which is dealing with the international side of health and keeping populations healthy, whether they'll be locally or in communities in other countries or nationally. And that's what I do on a daily basis in my clinical work, where I work with large organizations ranging from the UN and the WHO to smaller NGOs, but even prominent ones which you may be familiar with, like Save the Children and Red Cross. And why an understanding of public health becomes so important in my role and that kind of work is the fact that these NGOs are bringing people together from across disciplines, backgrounds, perspectives to work on the root causes of health in the regions that they work in. So a good example, for example, you've all seen in the news what's happening in Haiti after another earthquake. So I'm dealing with a lot of the response going there to deal with not only the physical ramifications of an earthquake, but the health ramifications of an earthquake. Cholera impacted Haiti in a massive way after the last earthquake, and we need to prevent that from happening again. So I need to have a clear understanding of how public health professionals collaborate and uncover these conditions, but also build interventions that address them. And that's what a public health qualification degree will help you do. And in my scenario, certainly let's say with Haiti, we need to understand how we're going to bring the engineers together to help work on water and sanitation with public health professionals, with policymakers, and with the local government. So they end up collaborating and learn and work and grow together to ultimately affect the health outcomes of the population that's been affected in Haiti. And this is a very similar approach to some of the work I'm now doing in Kabul in Afghanistan as well. So I hope that gives you a little understanding of where all those disciplines come in.
It does. And I was going to say, what the bit that strikes me there is the interprofessional, multidisciplinary mix of people involved. And in your experience, how important is that mix of professions on an actual public health program? Because obviously this program is going to be an awful lot more than doctors or even doctors, nurses, and pharmacists. It's going to have a far broader interprofessional mix on it.
Yeah, and it's a huge advantage if you can understand and work within an interprofessional environment, which what this course promotes. So working in an interprofessional environment means learning and collaborating from people in different professions, not necessarily just being in the same room as them. And that's incredibly important in public health, but also in health promotion, which is something that we're probably going to touch on a bit more here. But in terms of public health and health promotion, particularly the health promotion part, you're thinking about supporting governments, communities, and individuals to cope with these health challenges. But that means building, as I said, public policy, creating supportive environments, and strengthening community action. And if you think about what I just said there, community, policy, environments, they're people from different industries and qualification that you have to work with, but you have to work alongside each other. But the important thing is also learning from each other. And coming back to my Haiti example, I'm not a water engineer or a civil engineer, but I have to have a basic understanding of what water engineering is if we're going to address water infrastructure in Haiti. So I learn from these engineers, and at the same time, they'll learn from me as to how we can implement public health policies to help address the issues at hand.
Yeah, brilliant. And I think that, what we've seen across all of our programs is that when you get an interprofessional, international mix of participants on a program, you get a richness of debate, you get a sharing of experience, and it brings a different depth to the program. But I suppose, John, if I move on from that, I think public health alongside a couple of other niche areas have a kind of a special place within medical curricula. So public health is one of the few areas that can lead to a consultant status while not being a clinical discipline. So, you think of surgery, you think of pediatrics, etc. It's your route to consultancy is clinical specialism. Public health is almost unique in giving you that consultant status without being a clinical area. Why is it held up to such importance? I think you're muted, John.
There we go. Yes, I got that message, but I couldn't unmute myself. That's why I was waiting.
Apologies.
But there you go. No worries. Dermot, I think you're probably talking about the UK mostly there. Certainly in the UK, they were early on. They made public health available as a consultant specialty to non-doctors. I think the reality is that doctors tend to hold on to their status and don't like other people pinching their turf. But in a lot of areas, I mean, nurses do a lot of work in accident and emergency departments that doctors used to do, stitching and some prescribing. And in primary care, a lot of nurses are prescribing, triaging patients. In the anaesthetic room, physician's assistants and operating department assistants are taking a lot of responsibility for the care of patients. I think public health was just one of the early professions to recognize that and give non-doctors full professional status. That probably speaks to a little bit of the culture of public health, which is quite egalitarian. We think a lot about equality, opportunities in health, and that carries through into our work together, recognizing fellow professionals as equal status with doctors.
Yeah, I think you're right, and I think that word egalitarian is something that you do think of. Certainly, you think of you think of public health during COVID at the moment, and it is all about sharing data. It's about bringing everyone up together as much as you can, and it certainly has a spirit of openness that is wonderful to see. If I come to one of the last questions for this section is, within public health, there are different types of awards. You'll have the Masters of Public Health, you'll have an MSc in Public Health. Why have we chosen to go down the road of having a Masters in Public Health and Health Promotion? Why have we put the emphasis on health promotion within this program?
That is a bit distinctive. A lot of public health programs sort of concentrate on the management aspects and communicable disease control. But the reality is that a lot of health is dependent on individual behavior. The things that we do, what we eat, the exercise that we take, the places that we live, the opportunities that we avail. So public health is about more than just social environment and infrastructure and healthcare delivery. It is also about the way people behave. And even the programs that are put in place are often about changing the way people behave. So taxations on, say, sugar-sweetened beverages or taxations on cigarettes are about trying to change what people eat and change their smoking habits. So I think an understanding of individual behavior and choices, which is what is central to health promotion, is important also to public health, which is why we've brought the two together on this course.
And one of the things, and we'll get into it in a couple of minutes, I think, within the actual presentation, is the particular slant that we're taking in public health. There's two big domains in public health. There's the US approach and the UK approach, and I think we'll discuss that within the actual content. So, Rebecca, I was going to suggest moving into the actual presentation part now, if that, I see some questions starting to come in on curriculum, etc. So,
yeah, absolutely. I think it's a good idea.
Brilliant. Right. So I will, if you just bear with me for 1 second, I am going to start the presentation and share screen. Play from current slide. And okay, boom, 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 boom. Here we go. So hopefully everyone can see my screen now.
Yep.
Yep. Okay, great. One of the first things you're going to see is in this program will be IHEED used interchangeably in documentation alongside the University of Warwick. And it's important to give you some context as to who IHEED is at the outset of the program. So IHEED is an Irish company set up by a family doctor from the south of Ireland in 2013 and is now a division of Cambridge Education Group in the United Kingdom. What IHEED has done for the past 7 or 8 years is work particularly in building capacity in health systems across Europe, Middle East and Asia. For colleagues on the call tonight that are from Qatar, you've likely come across IHEED from the work we have done with Hamad Medical Organization, or Hamad Medical Corporation, I should say, particularly on areas like the National Diabetes Strategy, the diabetes guidelines, and the work we've done with HITC on lots of the health training that's been rolled out. In places like Saudi Arabia, we have done the new family medicine academies, which are putting huge capacity into the health system. In Saudi, we've done lots of work across UAE, across Malaysia, various other countries, all focused on online healthcare education. So our specialism is in bringing qualifications from institutions like the University of Warwick, the Royal College of Physicians, etc., to a global audience. And from inception, we've put about 400,000 course completions through our programs to date. And that's everything from full family medicine residency programs to master's programs to national diplomas and shorter CME training courses. So IHEED are partnering with the University of Warwick to bring their public health offering to a global audience. And the University of Warwick, they really are titans in the field of public health. So the University of Warwick is ranked 8th in the United Kingdom. They're ranked 62nd worldwide. In the UK, they're a member of the Russell Group, which is the group of leading research focused institutions. So, it's the Russell Group has, the Oxford, Cambridge, Imperial and Warwick, etc. The campus-based Masters in Public Health that Warwick has is a phenomenal program. It is ranked 3rd in the UK, it's ranked 12th globally. So the credibility that Warwick have within public health and the weight of history that they bring in delivering public health programs is phenomenal. They're absolutely world leaders in this. This particular program is, and I think one of the questions we always get in these webinars is, well, what's the difference? What will this qualification look like or be? And I think it's important to set at the outset, the award that you get from this qualification is the exact same as any other award from the University of Warwick. It is a level 7 on the UK's National Education Framework. It's a University of Warwick master's degree that does not mention online, does not mention distance, does not mention IHEED. It's simply a master's in public health and health promotion from Warwick, the equivalent of you studying it on campus, obviously with masses of flexibility built into the online environment. So the program, though, being an online program, it allows us to move beyond the Warwick faculty in the Warwick campus, which is phenomenal. So we've got people like Sadaf from the Saudi Centre for Disease Control, Katie Reid, who we've worked with for many years. She led the University of Manchester's Masters in Public Health program as their course director. Tim Feeney's from the British Medical Journal. we've got Ulrich Lasser, you know, so we've got really, really phenomenal names. And what you'll get on this program is a very international, diverse perspective. So it has all the benefit of and prestige of the University of Warwick with a global faculty and a global audience. So we're really, really proud of that. In terms, John and Kunal, let's go back to what people will study. So the program is split into 3 semesters, and each of the semesters has 3 modules in it. So the first semester has 3 6-week modules. So each of these yellow boxes here represents one of the modules, and then you can see the detail of what's covered in each week. And John, do you want to talk us through, you know, what, as you said, you know, there's the science and there's the art of public health. What made us choose this particular flow of modules for people joining the program? Oh, I think we need to unmute you again, John. Sorry.
There we go. Unmuted again. Yeah, so this first block of 3 modules is, I think, the basic sciences, and that the second block would be more about the art, the profession. So in these first 3 modules, we cover off most of what you need to know about the principles of public health. And that introductory module, public, population and personal health, starts off assuming that you are a clinician or that you think about individual medicine, and introduces you to the culture change of thinking about populations and global health. So there's introductions to the determinants of disease, things that make a difference to health and disease. Some of the classic sort of ways into public health, such as communicable disease control. Some of the earliest public health practitioners were people like Florence Nightingale and John Snow, a century and a half, 2 centuries ago. And they were controlling communicable disease. That's still relevant today, and particularly internationally. And so we introduced some of the other central things in that first module, the Global Burden of Disease program, which is measuring health throughout the world, and introducing people to the fact that you need health policy and public health action at grassroots level. The second module is that slightly scary one for many people, epidemiology and statistics. That is a basic science of public health. And we introduce you to statistical measures and study designs.
And John, how much, if you know, maths would never have been my strong suit. How much mathematical ability will I need to succeed in that module?
I think you need to be comfortable with adding up, subtracting and dividing. Okay. That's important. I think you need to be comfortable with what graphs mean. So plotting graphs, lines, charts, bars. A little bit of understanding of percentages and statistical uncertainty. But we wouldn't go into calculus or sort of higher level maths like that. So it's okay, just so long as you're comfortable with your high school maths, you should be all right.
Okay, so it's basic calculations with a focus on interpretation of statistics rather than going deep dive into what some people might understandably fear, me being one of them.
You said it well, Dermot. For the average public health practitioner, it's about understanding the analyses that other people have done, understanding and applying.
Yeah.
If you want to get advanced, you can and do the analyses, but that's not the core of this. Yeah. And then that last module is about the organized efforts of society. How do you get society and governments to change policies, to enact policies that promote public health.
Yeah.
So that's the first sort of three blocks, the first semester.
I was going to say, and you can see a logical flow there from understanding the frameworks of how public health and how disease control and things like that manifest, being able to interpret statistics. And, I think even the average layperson has become very akin to those charts and graphs in the last year and a half with all of the COVID data that's come out into the public domain. And then, what are the levers then that within society or politics actually influence these? So, absolutely. As far as basic sciences go, I think that there's a clear logical flow here, and we think it's normally an absolute minority that will leave at this point, but that in itself makes sense as a postgraduate certificate offering. The art then is where we come into arguably some of the more interesting modules on the program in semester 2.
Yeah, I mean, I think Kunal could probably talk to the international health bit, because he's doing that all the time. The health promotion bit, which is the first part of that semester 2 module, is, I think, the thing that you'd see in fewer of the public health programs, but is something that we think is important, which is, what is the art of getting individuals to behave in a different way? And part of that is around psychology and education. But there's also things that can be done to nudge or to encourage people to behave in different ways. And we will cover those in the health promotion part. And then the last bit, the health policy, economics and management. A lot of public health is about program budgets, understanding economics, market theory, and the funding of healthcare, and how to understand balance sheets and profit and loss in small organizations or large organizations. We'll give you the financial skills to make sense of that.
I was going to say, I think that is particularly relevant. And when this curriculum was being put together and approved, one of the things that we certainly had in mind was that someone doing a master's in public health, they are on a track into a position of leadership, and in whatever context that position may be, they will need to understand the financial and organizational context that they're in, and having that kind of leadership piece within the program was seen as really, really important. And I think you're right. I think a lot of the other public health programs out there, they don't have the same focus on health promotion that we've decided to emphasize in this. And we saw that as key to, if you're going to define strategies which will lead to better outcomes, that has to be at the heart of it. Kunal, talk to us about the international health piece and how some of these things like climate change and mental health and gender, etc., come into the public health arena.
So thank you. I think what's nice, and what you can see in this slide here, is that international health is wedged right in between the other two modules. We've got health promotion there, and then we've got health policy. And there's a wonderful crossover between all of this when it comes to professional application, as we said there, but also, as John has said, the art. But importantly, other two keywords, research and inquiry. You, as a public health professional, you've got to be inquisitive. And when that happens, and when you think about health promotion, and John touched on what health promotion was, enabling people to increase control over and improve their health. Look what's currently happening in the real world. And I come from my life and my career, and certainly when I worked in Southeast Asia, health promotion focused on strengthening health promotion capacity, and that focused on financing and infrastructure, which we touch on in that final module there. But then it goes on to promoting urban health, and we touch on that in terms of healthy cities and health equity. And then we also think about other settings, whether it be the workplace, the schools, and health literacy. And then importantly, that all ties in with current relevant issues which are going to impact health today, but also in the very near future, namely things like climate change, race inequality, and mental health. And so it's a lovely way of creating a modern course that's relevant to today, while also building on the sound foundations that you saw in the basic sciences. And coming back to my real world examples, those water engineers I work with can't do what they do in terms of the policy and the urban health and the health promotion they work on unless they have a basic understanding of water is. So it's the same here, and we're applying it more so in this module than in any other. But like I said, it crosses over very nicely between the health promotion and the health policy modules, and therefore it's wedged nicely in between the two.
Yeah, and I think, you know, across, if I go back, I think across the two semesters, so your postgraduate certificate and your postgraduate diploma, I think there is a really nice flow of content from going to, you know, why do we care about these things? How do we measure them? How do we interpret that? What are the big key factors that influence health? And then really getting into, well, you know, how can we impact this? What are all of those issues you've just spoken about in terms of actually having impact? And then when we go to talk to colleagues, that we've got the right leadership profile to have credibility. And I think that as a journey as a professional is incredibly strong. The third semester then, the third semester is all about research. So the third semester is when you get into the master's level and you're doing a professional project. And this is where you pick one aspect of public health or health promotion that interests you, and you do a deep dive into it. So you follow initially a taught component where, you know, you're brought through research methodology and you're choosing your research idea, you're reviewing the literature around the area, you're deciding, well, what's the best methodology to answer this question that I want to ask? You develop your proposal, you get ethical approval for it, and then you go out working with your supervisor and you collect your data, you analyze it, and you write up your conclusions. And that, you know, that is a reasonably standard master's module that you'll find in many programs. Where I think Warwick excel is they don't ask you to do a 15,000 word thesis or dissertation at the end of it. They ask you to do a 4,000 word journal article and a conference poster presentation. And that gives you, you know, it's a very innovative approach. It's far more like PhD by publication in terms of the ethos, but it gives you something of practical utility at the end of your qualification. So we want to have people publish and add to the body of knowledge in public health. And having such an international mix of participants on this program will be fantastic to enable that. So the journal article and the conference poster, they really give you a tangible CV enhancing piece at the end of your qualification. So again, the three modules, the PG certificate, semester one, that's 6 months where you're doing the first three modules. Then you've got 6 months doing the next three modules for the postgraduate diploma. And then it's a 10-month duration for the research module for the master's. So, you know, I think one of the other pieces about the program is it's very efficient in terms of time and how quickly you can get through it. What it actually feels like to a participant then, we will be taking just under 150 people onto the program for this coming intake, and that is a cap on the program. We keep the group size small to achieve that. So you will be in a group of 20 participants. You'll get to know that group exceptionally well. You get to know your tutors really well, and it will feel like a very small team of people working together, and you'll be with people from different countries and different professions, and that leads to really interesting debate and conversation. The 6 taught modules, so those six-week modules, the pace is perfect. This program has been designed from the outset to assume that everybody is a full-time professional and a part-time learner. So the flexibility of how you go through it and the pace of how you go through it, that intensity is just about right. The personal commitment, that it will be manageable within a normal clinical workload. We expect that most people on this program are going to be doctors, nurses, pharmacists, nutritionists, etc. Not all will be clinical, but we need to have it that this program works for people that have a very busy clinical load. And underpinning that then is a huge amount of support. This program is ran by a dedicated program management team. You will see that team every single week that you're on the program. There's always people to ask questions of, and there's a huge support network around the program. The average age on these postgraduate programs tends to be late 30s to early 40s. And what that means is that it's usually some time since people have had an experience of doing an academic program. So we give you a really comprehensive online orientation, and that gets you familiar with everything from the assessment methodology to how to use the online platform to what supports are available. You meet your peers and you get really, really comfortable before you start module 1, week 1. Each week then follows a pattern. So we'll start each week with a discussion forum, and that discussion forum will be linked to that week's topics, and will really ask you to kind of consider and debate that week's topic with your peers. You then go through and I'll come back to these in a second, you then go through the online learning content in your own time and at your own pace. And the online experience is going to be phenomenal for you in this program. What you're seeing here is just screenshots of some of the content. It's very visual, it's mobile ready, it's very interactive. What it's not is pages of flat text. It's not a bunch of PDFs or PowerPoints put up online. It is some of the highest quality bespoke online content for public health that you'll get, and it's full of videos from key opinion leaders. It's full of interactivities. So you really, when you join the program, what you get in terms of an online experience is huge. So one of the questions that we often get asked is, well, what textbooks should I get to complement my learning on this program? And our answer is generally none. We'll give you absolutely everything you need within the platform. So your week starts with that discussion forum. You then go through the live tutorial, you then go through the online content at your own pace and time during the week. And then towards the end of the week, you come together for a live tutorial. And those tutorials are generally on Thursday evenings in Europe and Friday mornings across the Middle East. So, they're the times that we found have suited people best and can fit in around your incredibly busy lives. So, that tutorial is the only part of the program that you need to be available at a specific time during the week. And then the continuous assessment of the program is simply you do your essays after each module. And I think importantly in this program, there's no actual examination on the program. It's all continuous assessment as you go through. So the rhythm that you can fall into doing the discussion forum, then going through the online content, and then meeting your peers at the end of every week to discuss, well, how would I apply this in my situation? And if I'm a nurse in Doha versus somebody who is a doctor in London, what are the differences in my populations, in my scopes of practice, in the resources that we have to look at this? So it's a really, really highly immersive and engaging online experience, and one that's hugely supported. So, John and Kunal, who are on the call this evening, you'll get to know extremely well. You'll get to know the tutors. We've a phenomenal group of tutors from across the world. Some will be from Warwick, some will be from other, similarly ranked universities. The program management team, you'll meet every single week. There'll be a member of the program management team on your weekly tutorial. And then, there's technical support people sitting in the background as well, that should you need them. In terms of, some of the statistics then on our programs, with Warwick, in the last 2 to 3 years, we've had over 500 students from 36 countries on programs with Warwick. 88% student engagement. And that says that our program design is working incredibly well, that people are able to attend the programs, they're able to engage with them, but nobody's perfect. No one will have 100% engagement, yet our pass rates are extremely high and our satisfaction rates are extremely high. So it is, it's extremely important that when people come onto the program, that they're given every support that they can, and that, the vast majority of people are matriculating, usually with very high grades at the far end. In terms of alumni feedback then, again, we designed these programs to have actual impact. So when we look at areas like patient care and career progression and reputation with colleagues, and, particularly, and this is something that Kunal has touched on as well, your understanding of research and your understanding of critical appraisal and being able to digest that literature yourself, as opposed to waiting for someone else's interpretation of it, that goes as far as transferable skills, that goes across everything that you'll do for the rest of your career. So hugely valuable.
Dermot, can I ask, why aren't on those graphs on the previous slide?
Mm-hmm.
When I read it, the question I had was where are the red bars and the yellow bars negative impact? Yeah,
they weren't reported. They simply weren't reported. So yeah, good question. But no, when we went back, the programs that people were on, we'd like to think none of them had negative impact on patient care, and they didn't. Similarly, there is no career downside to doing a master's program, particularly one with an institution as highly ranked as Warwick. Again, reputation and nothing there. I read a great quote the other day, which said, I'm worried about taking on this program because it's 2 or 3 years long, and when I'm qualified, I'll be I think it was 39, and the answer was yes. And if you don't do it in 2 or 3 years' time, you'll still be 39. So there's never a downside to advancement in this type of area, and certainly. And one of the questions I was going to ask John, in terms of program outcomes, they're pretty obvious here. You're getting an extraordinarily prestigious award from Warwick, which is, top 10 UK university. Where public health has that consultant status, you get the academic requirements for that. For people that are interested in taking the Faculty of Public Health's diploma or final membership exams, again, phenomenal preparation, and you get that you get that very transferable skill across critical appraisal and research. But the piece that I think a lot of people on this call are going to be really interested in is, what will this do for my career? What does a master's in public health, what will that actually bring me? So Kunal, John, where have you seen people go with a master's in public health? What journeys have you seen people go on?
I think often managers in hospital programs and healthcare programs will not just be doctors or nurses. They will often have a master's in public health as well. So this can be a part of a stepping stone towards a management career. And similarly, people heading up NGO programs. Again, it's a stepping stone into the management and the organization side. Some people use a master's, and I did, to move into an academic career. So to progress and start doing research. Other people become public health practitioners within organizations that do either health promotion or communicable disease control or other aspects of public health. They become practitioners. So those are some of the ones that I've come across. Where else have you seen MPHs come out?
I suppose, John, it's an expansion of what you've said there. It's what's interesting is that coming back to what John said very early on in the conversation is that it's a very much an egalitarian approach to public health, which levels where you can work are vast. I'll give you an example. When you're a consultant surgeon, you're a consultant surgeon. That's what you are. But if you're a public health practitioner, and if you choose to, you could work very much at the grassroots level, locally in communities, all the way up to national level, or go across borders and work internationally. So you could end up working for a large IO or international organization like the WHO or the UN, UNICEF, you name it, to large NGOs like Save the Children. But maybe you want to work more locally, in your geography. But the other nice thing that comes out of this as well, part of that egalitarian approach, and it's been highlighted in some of the questions that have been asked in the chat, is that this is an addendum or an addition to what your current expertise brings. So if we, for example, an individual is asked, will this help me because I currently work in environmental health? Absolutely. It would actually allow you to bring something back into the industry you're currently from, or it'll actually allow you to then enter another sector or industry. So the crossover is huge here. And that environmental health example is a very good one, which you may have just seen in the chat there. And then finally, I'd also say, in terms of career progression, this being an interprofessional course, but predominantly an interprofessional public health course, it's all about your international network as well. The people you're going to be studying along with are actually going to enhance the way you approach public health. You will learn from others. So if you are thinking about public health that crosses borders or working in certain geographies, you're going to be working with participants from other geographies. And that's very important in public health. You never just work by yourself. You're constantly working with others, whether they be on the other far side of the world or whether they be locally, because always we need to learn from each other when we're approaching these public health situations or issues, but also promoting health, which is what this course is also focused on.
Yeah, and I think you've both given the answer I was hoping you would, which is, it is a lot broader than a path to being a public health practitioner or public health consultant. There is such a range and breadth of opportunity depending on where your career interests lie. And, that is everything from academia to NGO to, and one of the things I think about a public health qualification is how well it travels. The passport that it has, they are recognized worldwide. It is the accepted standard within the discipline is I have a master's in public health. I'm conscious of time. I'm going to move on. So in terms of how to join, it's a very, very straightforward process. So the entry criteria are an honours bachelor's degree from a recognized institution. And that is, while we anticipate that lots of people in the program will be healthcare practitioners, it's not going to be exclusively healthcare practitioners at all. There will be people involved around the broader areas of public health. So it's simply an honours bachelor degree. And you need the ability to complete the program through English. Because people are not traveling to study in the UK, they don't need a tier 4 visa. Therefore, an English language proficiency test is not a requirement of the program. We do obviously need you to be comfortable that you have the standard of English to succeed in the program. And we make ourselves comfortable with that through the conversations that you'll have with the education advisors before you come on board, and the personal statement that you'll give us of 500 words as part of the application process. So we will ask you for your degree transcript. We will ask you for your personal statements. We'll look for an employer or an academic reference letter, and that's simply to say that you're a professional in good standing, and then we'll ask you for photo ID. What I said a few minutes ago about the group size and maintaining the group size, that limits the amount of spaces available on the program. And we absolutely anticipate that this program is going to be oversubscribed, which is fantastic. But what it does mean is if you want to join the program, early submission of your application is very, very advisable. So in terms of doing that, there are, and fees is going to be that I suspect the next question that will be asked. So the cost of the Masters is 12,000 sterling, and the cost of the postgraduate diploma is 8,000 sterling. There are very significant discounts available to you if you register and or pay early, and you can see those listed there. So bringing the Masters down to 10,000, bringing the postgraduate diploma down to 6,500. So they are very, very significant reductions on the fees available if you sign up. Those particular deadlines are the end of this month. So not a huge amount of time, but very substantial discounts available to you if you do. Once you're on the program, there are multiple ways that you can pay the fees. You can pay them up front, you can pay them by semester, you can pay them monthly. And again, that's something that the education advisors who you'll be talking to, they'll discuss all those options with you in detail. The program is also eligible for Student Finance England if you are based in the UK as well. So I've no doubt we'll come back to these fees at the end, but effectively, if you register early and register and pay early, the fees can be as low as 6,500 sterling for the diploma and 10,000 for the Masters. So yeah, they are the fees. This program is designed to be accessible to people across the globe, and it is priced accordingly so that we can have as broad a representation of people on the program as we can. So I'm going to stop talking now and move to questions. I haven't had the chat open while this has been going on, but it's flooded with messages I see. But in summary,
yeah. Sorry, go on, Dermot.
No, I was going to say, so just the summary, it's a 22-month master's program. It's made up of the postgraduate certificate is 6 months, the postgraduate diploma is 6 months, and then the master's program is 10 months. And, that is probably one of the most efficient ways you can do this standard of qualification. And, the benefit of being able to do this online bakes all of those efficiencies into the program from the outset. In terms of the university, Warwick are absolutely, they're a huge name in public health. Their on-campus program is one of the most highly regarded master's programs in the world, third in the UK, 12th in the world. This brings all of that quality to an online international audience, which is just phenomenal. And in fairness, to an audience that lives outside of the catchment area of Warwick in England. The recognition of the program is worldwide. Warwick is on all of the approved institution provider lists across the Gulf and Asia. The program being part-time, I think, is really important. And if it hasn't come up in the chat, one of the questions we usually get are, how many hours a week would I need to put to this program? And I think, so you'll do your discussion activity, and that will take probably about an hour during the week. Then you'll have, you'll go through the content on the online platform. That'll take about an hour. And then you'll have your tutorial for about an hour. And then outside of that, it's, what reading are you doing around the program? What preparation for your essays are you doing? So we think by the time you add all the different elements up, you're probably, in a light week, you're probably spending about 5 hours on the program. And in a heavy week, you're probably spending about 8 to 10 hours on the program. And, that will ebb and flow as as you come up to assessment, you'll do a bit more. And as immediately after assessments, that'll drop to practically nothing. So, it is very, very manageable for a full-time professional and a part-time learner. One of the things that never comes across in these is just how open and fun the program is. You'll be in a small group, you'll get to know your tutors well. They are really, really passionate educators who, they love public health and they love education. So, that camaraderie and that support is a really, really integral part of it. As Kunal and John have showed, there are endless career opportunities that come from a master's in public health. And it's a really, really rewarding and engaging thing to do. So, Rebecca, I'm going to stop share here. I have about 80 messages on chat that I haven't seen. How have the guys been getting on?
Yeah, most of the chat has been answered already, Dermot, to be perfectly honest. There was a few I know Faheen asked a long time ago, which I wasn't sure if SPSS is covered as part of the statistics package, or just like, I know I loved SPSS in university. It was delightful. Just wondering if we still use it as part of the statistics analysis.
Not really. Across the earth. So we show people how to use a free program called JASP, which is a visual usage of R, which is public domain software. R is used by lots of academics, but JASP is easier visual.
Yeah, I think I've used it quite a bit, John, and I think visual is the key. What I always found with SPSS was, if you were very numerate, SPSS was great, and if you weren't, it was tricky to get around. I think JASP is far more intuitive to use, but the focus, unless you are doing heavy statistics as part of your research module at the master's level, certainly in module 2, the focus is on the interpretation of data rather than creating the data. When you look at distributions, do you know what they mean? So yeah, that's a slightly different stance. So wouldn't be focused on SPSS at all, really. And they are tools, and they're either tools to create data or interpret data. We choose the ones that we think are more intuitive. Paul is asking, will there be means of discussing course funding options, etc.? So yeah, absolutely. This is the education advisors will be reaching out to everybody afterwards to discuss exactly that and give you all the options. What else is
there was a discussion there from Chibuchi. In terms of, he's an undergraduate medical student in 3rd year. Unfortunately, you have to have your MBBS, Chibuchi, before you be able to join us on the program. You must be a graduate. And a similar answer really applies to Koshi, who asked earlier. She has, I believe, a diploma in nursing. Unfortunately, we do require a bachelor as the minimum for entry onto the program.
Yeah, exactly.
Rebecca, there's just one caveat to that. Some people might have a bachelor's degree after 3 years study.
Yeah, no, absolutely.
In that case, they could.
Of course, but Chibuchi is in 3rd year of his MBBS. Yeah, so he's not a graduate as yet, I believe.
Yeah. So no, what Warwick, it's very binary. It's if you have a bachelor degree, welcome on board. It doesn't matter the discipline it's in. If you don't, then unfortunately you would need to wait. What else has come in that we've missed, Rebecca?
There has been a lot around funding and questions. Obviously, if you're based in the United Kingdom, you may be eligible for support from your trust if you're working in secondary tertiary care, or from your CCG, or indeed PCN, predominantly CCG, if you're in primary care. So I would advise, and we've had multiple clinicians who've been sponsored by their trusts and CCGs in the past on our programs. So I would advise that would be your first recourse. You either go to your clinical director, your director of nursing, or your head of training and learning or professional development to ask if you're eligible for the funding, and you may well be. If you are in the Republic of Ireland, we have a number registered for today. If you're in secondary care within the HSC, a good number of our clinicians have been sponsored in the past, particularly nurses. For some of the other countries and nationalities that are on here today, unfortunately, the funding is less likely. But that is the reason why we are very flexible around the early bird or the early registration discount. So we do also offer, if there are group clinicians and a number of colleagues in a particular organisation, we will give group discounts and reductions, as well as the flexible payment options to pay on a monthly basis rather than upfront in advance. And also in the United Kingdom, we get the Student Finance UK as well as an other way for you to get financing for the program. So there's multiple methods of assistance.
Yeah, and Rebecca, a couple of things that I have just been reading and inferring from the chat. One is in terms of tutorial timing. So there will be a number of groups available, and you can choose the tutorial time that suits you the best. All of the tutorials are recorded and they're available either within a couple of hours or the next morning of when they take place. So if you have a clinical commitment or a work commitment and you happen to miss a tutorial, that's no problem. It's sitting there for you and you can watch it back. You can even text search for when things were discussed during it. So there's a huge amount of flexibility built in there. The course intensity percentage is so it's effectively it's 50% for the cert and diploma and 50% for the MSc. So it is, you know, it's designed as that, and you know that works well. Trainee, can you start with the postgraduate certificate? You absolutely can. So you can come onto the program deciding, I'm going to do the Masters in Public Health and Health Promotion, and you can decide to exit with the postgraduate diploma if that's what you'd like. Similarly, you can enroll on the certificate or diploma and decide, well, I'm just going to continue on. I want to go as far as the Masters level, and that's fine as well. You know, it is accredited as one program with 3 exit points, and you know you can choose your exit points. And you know, a lot of people will choose to do the Masters. Some people will choose to exit at an earlier stage, and all is absolutely fine.
And Paul, yes, we will have another start date in early 2022, spring 2022.
Yeah, absolutely. What else had I seen up above? Yeah, is this a route into academia? And I think, Kunal, we covered this, I think, in our conversation. Absolutely. And not necessarily just academia in public health. It's, as John and Kunal have said, you know, a lot of professionals, irrespective of the particular discipline they're in, this is one of the key postgraduate programs that people working in health systems tend to have. You know, people will either be qualified in public health or in education or in patient safety or quality or something like that. It's one of the main postgraduate offerings that people have alongside whatever else they happen to be working in.
Yeah, and I'd add to that, in that what's amazing about this course is that not only are you going to get a foundation in public health, which we've talked about extensively, that research components, which the team have highlighted through the slides there earlier, is building towards an assessment based on a research paper. And if this is your first time ever doing research of this kind, that's a fantastic way to start. Because ultimately, if you want to enter academia in whatever fashion it may be, whether it be a lecturer or a teacher or purely delivering public health research, the understanding of how to deliver a paper is vital in the field of public health, because that's where the evidence is generated. And that's how, let's say you want to enter policy. Policy is written based on the papers that are published. So that second half of this course, even if you've never done research before, is going to introduce you to the basics of research, how to conduct research, and how to formulate it to a point where you can write a paper.
And ultimately, I mean, what excites me the most is when we see our alumni taking those journal articles that they've done for the program, taking the conference poster presentations and actually using them and putting them forward for publication and utilizing them. That, you know, as much as the program gives you all of the academic and foundational knowledge, to actually come away as well with something tangible and something that is, you know, directly benefiting that much broader research skill set, I think is hugely important.
And can I say that I mean, my other job is I'm a journal editor, but when I did my Faculty of Public Health exams, we were asked to write a dissertation, which I think was about 10,000 words. That's completely the wrong skill for anybody writing a journal article, because you have to be short, succinct, and get your message across. Whereas in a dissertation, it's often spelling things out at length. So this program is actually, in that master's part, teaching a skill that is much more useful in academia, in my opinion, than writing a dissertation.
Yeah, no, I completely agree. I think it's a different skill set for sure. And succinct, clear, interesting writing is something that we certainly hope people will come away from the program with. The other thing that we find again is people will approach any program like this with an apprehension about, well, I haven't written an essay in 15 years, or I don't know how to do referencing. It's been years since I've done that. We bring you through all of that. The kind of academic writing training that you get, again, is a really good transferable skill that you get from the program. And nobody's module 1 essay is ever as good as their module 2, 3, 4, 5, or 6 essay. And that there's always a natural progression in terms of people's quality of what they're writing. And yeah, by the time they get to the master's level, they're writing quality that is publishable. And that, to us, that it's a huge part of the program, that you're giving people this academic credibility coming off the program, which is phenomenal.
And Sabrina, you did say amazing, no 10,000 words. I would say, I know Oscar Wilde said, I wanted to write you a short letter, but I didn't have the time, because sometimes it's actually very easy to write something long, and it's so hard to fit everything you want to say into a smaller piece. And that's the I suppose, the talent and the specialization of journal articles, that to be succinct, a long time to cut it down to be really publishable. So actually it's a challenging area in itself, and you will be taught how to do that to a very high level.
It absolutely is. But what I love about the journal article side of it is, if somebody is doing, for example, a systematic review, unlike a dissertation where you've got kind of your big buckets that you need to fill, there's a template to follow. There's a template of, this is how you do a systematic review, and you generally don't go outside that. So it's actually more structured than a blank page dissertation is, which there's guidelines for journals that they help you in terms of how you're going to structure what you're going to do. So yeah, I think, but ultimately, I think the assessment on the certificate and the diploma of you're doing essays that are reviewing the literature in an area, and critically then asking, how are they relevant to your professional context? That's really important. And then the assessment for the masters of, produce a journal article, produce a presentation that you would give at a conference. That they're real life skills. They're things that you will actually do time and time again throughout your career. And to do that in a safe environment with lots of support is, that's really rewarding.
Yeah, there's no January intake. It will be late spring. We do break for Christmas and we break for Ramadan, and we were very conscious of the large religious festivals that our participants who participate on the program in their local region. So we do have our start dates really measured and commenced around looking after that schedule of religious festivals in each country. So we don't start in January, it will be later on.
It will be later, significantly later into the spring. The other question I was asking about, is the deposit included from the total fee? It is. So the deposit is included in the total fee. The program spaces are limited, and they are allocated based on effectively who has their deposits paid first to secure their space on the program. That is the simplest, fairest way of allocating a limited amount of spaces. Is the people that apply first and pay their deposits, they get the spaces on the programs.
We have 30 maximum per cohort in each time zone, so when that's full up, that will be full up. We don't register and enroll with impunity. We do have essentially that 30 is our hard stop per time zone that we deliver the program in. We have all our programs fill quite quickly. So if you are interested, I would advise to proceed to deposit payment, and also to secure quite a significant discount. It is a lot of money. So and that offer does end on the 31st of August. So
so I'll just put those up again to show what the discounts available are. And as Rebecca said earlier, if there are a group of people that are enrolling together, by all means come and talk to us. But the reductions there of from 12,000 to 10,000 and 8,000 to 6,500 are, they're sizable fee reductions.
And just to reiterate, to go to study this the MPH in the University of Warwick face to face would be 24,000 sterling per annum over a 2 or 3 year period. So the online alternative is a lot more achievable.
No, and this program is being especially designed to be accessible, so it is positioned at a very fair price, and then within that there's lots of flexibility on payment options as well. So it's worked extraordinarily well to date, and we hope lots of you will avail of it as well.
Intake's 24th of October is the forthcoming intake.
Yeah, so exactly, Rebecca. So the intakes on the 24th of October. We normally see about 50% of the space is gone in the next kind of 2 to 3 weeks, and then the rest fills after that. So it will go over capacity. There's no danger it won't. So if you are interested, I would, as Rebecca said, would suggest applying sooner rather than later.
Just to let you know, yeah, we will be sending you a full email with the recording from this evening, just a link to apply and a link to pay your deposit, and our education advisors who are just exemplary. We have many of them on here this evening and answering your chats. They will be reaching out to you in person to see if you need any assistance with your application, or if you have any other questions around finance, etc., and your payment plans. So we will look after you, and you will hear from us in the coming days.
Yeah, exactly. And yeah, that fee is for the whole program. You can't minimize the study to 12 months. There is no full-time option available. The program is designed for part-time learners. It assumes everybody is a working professional. And to one of the questions that was up above, be that clinical or not, it's equally open to non-clinical professionals. We've probably had perhaps a little too much focus on clinicals tonight, but it is open to clinical and non-clinical alike. So yeah, Rebecca, I think there
was one more
repetition of John. Sorry, come in.
There was one more question I spotted, Dermot, which was: is this the first time we're running an online course? Certainly not. We've been running online masters for is it 5 years now? 4 years?
20, yeah, and yeah. Just to let you know, I know many universities, because of the pandemic, of course, had to put their learning into an online environment. We are an online medical education organisation. We, at the outset, have our instructional designers and our project managers and our engineers who storyboard and create very engaging and palatable online experience for you, with an online intent always, and that's what we create. So we start the whole syllabus, everything is built and delivered with from inception onwards. It's been created for an online consumption, and we pride ourselves in that being extremely advanced and very engaging. And you saw there from Ali earlier, and one of our Qatari participants, we have over 40,000 Qatari nationals on our platform, and they would attest to the caliber of our programs as well. So it's something we pride ourselves on, and you won't be disappointed in the learning experience.
Yeah, I think one of the key, just I suppose the final thought that I'd leave people with is, it's the flexibility of the delivery that allows you, it's the quality of everything that Warwick have to offer, but you only have to be available 1 hour a week to be at the tutorial. And even that is recorded and available to watch afterwards. So you really can fit this in around a busy professional life. And again, it is open to clinical and non-clinical. Everybody, just to answer Bala's question there, everybody does need either an academic or an employer reference to come on. So the entry criteria are standard for everybody. So yeah, thank you all so much for attending this evening.
We have gone over our hour. Very sorry about that. I know you're very busy workers and clinicians, and thank you so much for joining us so late in your evening when your time is so precious. And you will hear from us by tomorrow with an email with more detail and a recording of this event this evening. So thank you so much for joining us. It's been a pleasure, and thank you, Dr. Fletcher and Dr. Patel. It was a pleasure to have you on the scene.
Thank you very much.
Thank you. Goodbye.
Thanks so much, everyone.
Take care, guys.
Bye.